This is going to sound boring to start, but it's just a little bit of boring information. And then we'll get into something that's very practical. And this is something I call the role of relational data structure in a pedagogy for teaching clinical hematology and other medical disciplines. Now, the pedagogy is kind of an unusual term, but it's a method for teaching complex information. And several years ago, I was teaching some of our fellows. One of our faculty was a pedagogue, proven beyond all doubt. And of course, they thought I was making an attack on that particular faculty. So I just thought I would use this for my Hemont Grand Rounds this last week. But I want to talk about changing the way we teach hematology, at least in medical school the sophomore year. And I'm essentially responsible for the anemia section, unless I get booted out by the class of last year. The project I'm going to show you is something I developed actually 20 years ago, but it's a piece of software that needed to be rewritten in a professional manner. And so I asked the Weiss-Weiler for a small grant to fund this effort for changing the teaching methodology, and it was funded, and so it's there's no conflict of interest, but it was funded by a micro grant. My name is Rick Mansour, by the way. Some of you older folks know me, and some of you younger folks do not. I'm a hematologist, and I've been in medicine. I guess I graduated medical school in about 40 years ago, and about 38 years ago I started working on computer software to complement my medical work. So this particular project I began working on about 20 years ago, and I spent about 15 years as the Chief Medical Information Officer for several major electronic medical software companies, the most recent 10 years being the Allscripts Corporation. But I always worked here part-time until recently I came back full-time. About 20 years ago, I was working on some software, and the challenge that I had was medical oncology was being inundated with algorithms. Of course, medicine is inundated with algorithms. And the thought for the day was, how do we incorporate these algorithms into electronic medical records and electronic information systems and structures? And this is not an important algorithm for me, but it's just one of thousands that exist now in the field of hematology and medical oncology. And it does mimic the way in which we see cases and ingest information and make decisions and make choices. And so that there are many steps along the way where evidence-based guidelines dictate the choices that we make. And I thought about how to do that, and I'd been programming for a long time, and I created a lot of software prototypes. And in computer languages, all the languages, no matter what it's actually called, they all have these logic flow control statements that if the user selects A, do B. If the user selects B, do C. If the user selects C, do D. Else do E. Things like that. And of course, you can create one algorithm with this kind of language, but if you try and tackle every clinical situation that you might see that has evidence-based guidelines, particularly in oncology, that would be a completely unworkable solution. In other words, this solution does not scale to the challenge that we face in clinical medicine. So I had this great idea. At least it seemed like it at the time. I don't know if this is going to actually work. Probably not. But anyway, I had this idea that I could create some very simple software and create a relationship in a database, relational database, that would mimic all of these different branching guidelines, and it would be easy. It would be easy if I had a configuration tool. It would not be costly. It would be very scalable. So I'm going to show you that software today, but I have to bore you a little bit first. You're all familiar with Microsoft Excel spreadsheets. Those are known as flat file databases. You have one row. That one row usually pertains to some item in the first column, which is the subject of the row. And then there are multiple columns, which might be variables or objective findings, true, false, etc., about that thing in the first column. In a relational database, it's like a series of Microsoft Excel spreadsheets, except that there's usually some concept that some of the tables or spreadsheets identify specifically some physical entity, like a patient. In this case, there's a question. This is the question table. And at this point, it has two columns, a unique alphanumeric identifier and some question. So if I had, several questions and several answers, I could just walk through the questions 1, 2, 3, 4. But of course, that's not a guideline. It's not an algorithm. It wouldn't branch anywhere. And this is an answer table for this question. So this is the question: what's the first test needed to determine the cause of anemia? And here are the 4 possible answers, and this is the sequence in which they will show up to the user. And the way that we know that this set of answers belongs to this question is that this identifier is captured in this column. So each answer has its own unique identifier, but they all have the same question identifier. So that's how that works. There's 2 different tables. They're related because the key for the row in the question table is replicated in each row of the answer table. So if I had 30 questions and 120 answers, you would basically see this same configuration. That still didn't get me to a branching algorithm. So the next step was, well, what if I had questions and I had answers to the first question? What if I put another column that if I picked an answer, it would point me to a specific question? So if I picked reticulocyte count, it would take me to question number 2. But if I picked LDH, well, that's the same one. That would be, well, I think I may have this a little out of order, but the concept is that anytime you pick an answer, it points you to a different question. So now you can take a question and ask the user to pick one answer, and depending on the correctness or incorrectness of the answer, you can send them to another question that will either be progressing through the case because they made the right choice, or it could be a question that basically says the patient died, or it could be a question that remediates the user for information. So with this concept, I built several different prototypes, some of which made their way into some commercial software. But one of the things I did here was I built a case education software that we used in the sophomore medical class from maybe 2003 through 2006, and then I couldn't maintain it because I had too many other obligations. And what I wanted to do was to bring back this education software. But the success of software has a lot to do with having an idea about how to make it work. It is also very dependent on the ease of use and the beauty of the front end. So I wanted to get a professional software developer and to help rewrite this so I could bring this back into the education. Now, in addition to the concept of using the database to branch, which makes the code very easy, in terms of building content, I wanted to have a strategy where if the user picked the correct answer, I would let the user progress through the case, which I'll show you in a minute. But if they picked an incorrect answer, I would want to send them to a remedial question to give them more education. And then if they picked the correct answer to that, then they would progress through the case. If they didn't, I would send them back to the first question pretty much to start over again. And this is just thinking about how to build content for one of these. But this is what the software looks like. Now, with my micro grant, I made an arrangement with Dr. Urska Shvek from LSU Shreveport in the Department of Computer Science. And she assigned a master's level graduate student to take on this project for their full year project to obtain their master's along with whatever else that they have to do. And I was very fortunate in that the developer or the master's student who signed up for this project is extremely talented, has a good sense of style, and to make things appealing to the user, and also understands the concept that if the user makes an error, that it's easy to back out of an error and not frustrate the user to get them caught up in going in circles trying to use the software. So I'm going to show you an example of one of the cases. I don't have my old cases yet reinstalled, but I'm using real cases that I use to teach our fellows. And I have medical student level cases, and I have fellow level cases. And I'll show you what type of subject matter I think makes a good case. So the users are assigned to, let's say, the class of 20, a class of 2021, class of 2022, and the cases are assigned in groups. So as a class of students or residents or HEMONC fellows, they stay the same class, but they're reassigned different sets of cases to keep the work to a minimum on the part of the person responsible to keep this up. This is the patient who came to the emergency room with red urine and a little bit of breathlessness at some time in the last couple of years. And he had a prior history of painless red urine approximately 5 years before this particular visit. And no diagnosis was made at the time. The CBC was ordered and resulted. And the initial assessment was the patient had anemia. The hemoglobin was 8.6, hematocrit 25, and hematuria. And this is the way the lab was reported in the electronic medical record. So for sophomores students, this gives them a kind of an introduction to the way things appear in the electronic medical record when we're teaching the hematology course. So this is the backdrop, the case, and the next thing that comes is the question, in order to evaluate a low hemoglobin hematocrit, which test would be the most helpful at this time. So my point is I'm trying to teach the students the first step in the evaluation of the anemia, which is the reticulocyte count. But I don't know that because I'm a student, and I'm just going to pick an iron profile with ferritin. And I'm going to submit my answer. Now the system tells me that the iron profile with ferritin is incorrect, the reticulocyte count is correct, and it gives them an explanation of what is wrong about this answer. And then it takes them to the next question, which in this case is a remedial question. I've messed this up when I was trying to get it ready, but there was a remedial question. I think I've got them confused a little bit. So I'll go into this. This is a description. I tell them to click the link below and take a look at the image. And then I explain to them that the blue cells, the dark blue inclusion bodies are reticulocytes. And then I go through an explanation of what a reticulocyte is and how many there should be and how there are different types of anemia where there's decreased and normal and increased numbers of reticulocytes. And then the user is asked a question. And the question this is, what test reports the percentage of red cells that are less than 3 days old? This actually is the remedial question. And they're supposed to answer reticulocyte. And if they do, then it goes to, it tells them they're correct, and then it takes them to the next question in the series. If they were incorrect, it would have taken them back to question number 1. So there's branching in the structure, but in the content strategy, there's remediation. So you can think about your lectures for different types of anemias and other, I had some oncology in this too. You can think about the way that you learn this, lectures, PowerPoints, etc. And this is an augmentation of those methodologies. So let me leave this for a minute and come back. So branching and remediation. In the configuration tool, when I create the question, the very important thing is they built a good configuration tool that works over the web so that we can extend the authoring privileges to people other than myself. And this is what the set of questions would look like in the authoring tool. And in the authoring tool, for this question, these are the answers, and we indicate whether the answer is false or true and what the rationale is to feed back to the user when they select this. And then the most important part about this apparatus is if I select this answer to this question, what is the next question that we're going to offer the student? And so by selecting the next question based on the answer in configuration and content building, this is how we create the concept of a branching logic tree and reinforcement of the education to the student. So when it's all said and done, we have this relational database structure which has questions with sequences for the questions. I actually decided to put numbers in front of these so you could see where you're going in the front end. And then you have the answer sets where you have the next question that's going to come up depending on which one of these answers that you pick. So in the second year medical course, the kinds of cases that I've used before are basic hematology. Iron deficiency anemia, anemia inflammatory disease, that's 75% of all anemia seen here at UH and UH clinics. I know this because I've run the numbers on the EPIC database. Sickle cell anemia, autoimmune hemolytic anemia, beta thalassemia minor, pernicious anemia. So the major types of anemias, because this is what we teach in the sophomore course. And then in some of the malignancies, a case of Hodgkin's disease, chronic myelogenous leukemia, chronic lymphocytic leukemia, we have an abundance of these cases in hematology clinic. It's very easy to pick a case and to create the teaching points. And for the fellows, in our fellowship we have 17 fellows. They have 3 years. There is a variability in the experience for each fellow because some of the fellows see a rare case, another fellow doesn't see a case like that at all in the 3 years. So in order to compensate for the variability of chance of the types of cases that you will see, like this case with G6PD deficiency, sounds like it ought to be common, but we don't diagnose it very commonly. We probably don't not diagnose it nearly as commonly as it actually exists in our clinical world. We saw a case of paroxysmal nocturnal hemoglobinuria. We may not see another case of that with Budd-Chiari syndrome in 20 years. So that's definitely the kind of case we want to capture and give the fellows the experience of working through the case without knowing what that case is. The immediate treatment of promyelocytic leukemia, it's a type of leukemia that is generally cured without chemotherapy, but if it's not approached correctly in the first few hours, we could end up with a patient who dies from an intracranial hemorrhage. Acquired factor VIII inhibitors, I forgot to fix that slide, in post-surgical patients with hemorrhage. We see this about every 3 or 4 years. It's a tremendously dangerous situation. The treatments are in evolution frequently. And so these are the kind of cases to capture that I want to capture for the hematology fellows. Now, because we have an authoring tool, I would hope that if we get this going, that there are other disciplines that might want to offer case education. When I first did this as an experiment back around 15 years ago, some of the pulmonologists and Dr. Burney submitted some cases, so we offered some rheumatology cases and some pulmonary cases. But when you're going to build a case, it's kind of like a lecture. It's not, you don't stay up all night and throw all your slides together, and as soon as you finish 5 minutes before the lecture, run up and just blurt it all out. You want to build a strategy of what are the teaching points for this case, whether it's for sophomore students or medicine residents or HEMOC fellows. What are the points that every person who's a student for this needs to know? And you want to design your questions to make sure that you make those points in the questions. And if the answer is not selected, the correct answer, you want remediation questions, which gives the students more information to read and more pictures to see. It could be x-rays, CAT scan images, blood films, diagrams, to reinforce that education. And anything you would put on the test, if you were giving a test, you would want in this question. If you were going to have test questions about a disease, anything you'd put on that test, you would want to emphasize in this strategy and make them learn it, because this is not a one-upsmanship or I got you. I could make a lot of the patients die with certain answers the student pick and put them in shock. But the point is you leave no one behind in essential education. So in order to do this, you collect materials, blood films, images, CAT scans, PET scans, any kind of visual that you need you would look at clinically to make a case. The lab, screen captures of lab reports where you get rid of the patient's names and the dates. And you create a PowerPoint case presentation. You write the questions and you put the strategy in the PowerPoint. And once you think you've got it right, then that's the kind of case content that would be used. Now let me kind of run through this one a little bit more. So this was the second question. Given this result, this patient had an elevated reticulocyte count. Which one of the general types of anemia is most likely causing this? And so in this case, the answer is hemolytic anemia, but I'm going to pick anemia of chronic disease and submit it. It tells me that I'm wrong, and it has the ability to open links to articles. And this is just a little article I picked out from Medscape that explains the reticulocyte count and all about it, just in case my explanation wasn't good enough. And then we go to the next question, and it brings them back to a question that reinforces, in a patient with a very high retic count, what is the most likely explanation? And so by this time, I'm hoping that they will pick hemolytic anemia. Otherwise, the system will send them back to question number 2. Or I could send them anywhere, but that's what I did for this strategy. So they got that correct. It's a hemolytic anemia. So in addition to examining the blood smear, which of the following tests is needed immediately? So actually there's more information about the case. There's an image. That's where the blood smear is supposed to be. In addition to that, with hemolytic anemia, what's the most important test for a patient who comes to the emergency room? And of course, it's a direct Coombs test. These other tests are used in hemolytic anemia, but they're more of an elective basis for adult anemia that is not Coombs positive anemia. So there's a, well, let's miss this one too, because there's a remedial question. If you don't know about a direct Coombs test, then there's an article that takes you to what is a direct Coombs test. And in addition, there's an image that explains a direct Coombs test. Again, this is all in the content building. And then a positive direct Coombs test is indicative of what? And we'll just put autoimmune hemolytic anemia. And we'll just go on to the next question. We'll just finish this up. This patient had a G6PD deficiency that we were able to diagnose 3 months later, because whenever you have hemolysis from G6PD, the older red cells that are deficient are killed off. The younger red cells measure a normal level. So it took about 3 months later to answer this, and all of these drugs will cause it. It was actually identified as people were, as soldiers were given anti-malarials to protect them in some of the previous wars. And then this is a link to a nice article that's in the New England Journal this year on G6P deficiency and favism. So this is a very large article, but just show it to make a point. And then if the user hits review, it will show them everything they did right and everything they did wrong. And they can download a report. It's a nice PDF file that they could save to study for a later date. And in the authoring tools, I can track everything that every student does and have total oversight as to what's happened. Which in the medicine course, the hematology course in the second year, we give bonus points for various things, like 1 point to the end of to the total of your score at the end of the hematology section. So it's possible that maybe we could have a system where students who went through all the cases got a bonus point. The other thing that I think would be interesting for those of you who want to study a little bit about medical education, I noticed since I'm the program coordinator now for Hematology and Oncology, there's a journal, it's a journal of medical education that comes out and has articles. And I think that this is a system that we could probably study if we devised the right question and the right mechanism to see what kind of effect it could have on retention of information over time. So let's see, last time I clicked this, I didn't exactly get what I want. Let me see if it does it. So here's the summary report of this, everything that the student did, which downloads for them, and they can save and review, to keep that feedback system of learning going. So this software, of course, was built by this graduate student, Sridan Ristic at LSU Shreveport, under the direction of Dr. Shevek and Dr. Trushell. And basically, we own it. We don't have to buy it. We're going to, after he's finished with the user's manual on the configuration tool, we're going to have it installed, at least so I can use it in the sophomore course and in our fellowship. And I'm basically introducing it to anyone who would be interested in working with a tool like this. It's professionally done. It's attractive software. It's easy to use. It's, again, the way the software is written, it's very forgiving if you make a mistake configuring cases. It's easy to back out and to, fix whatever it was that you did without frustrating the users. So that is all the information I have to share with you. But if you have any questions, I'll be happy to answer them. Yes?
A question, a comment. This is excellent, and I'm wondering if you'd be willing to talk to the various course directors of all the sophomore courses and see if they'd be interested in incorporating this into their...
Sure. I'd love for it just in a in just sort of an informal way to offer some, what I would call very basic cases to freshmen, so they get a taste of clinical medicine in the middle of their basic science. Believe it or not, I remember back to 1973 when I was a freshman, and I like to read some of the really easy, what you would call a throwaway journal today about urinary tract infection or some kind of little problem, because it kind of kept me going through biochemistry. Why am I here? So sure, I would love to do that. The developer is doing some scalability testing. He told me he was going to test it for 500 concurrent users. So when he's finished, hopefully we won't have to worry about it crashing if multiple people decide to cram the same night. Any other questions? Okay. Well, now you know what a relational database is.